So I would like to thank Amanda for joining with us today for our guest presentation. Communication after stroke is a significant issue. As many of you know, about 60% of stroke survivors have some issue with speech after stroke. Amanda addresses practical ways we can communicate with people with speech issues after stroke. Amanda is a senior speech pathologist at Wollongong Hospital. She has a Bachelor of Speech Pathology from the University of Newcastle and has been working as a speech pathologist for 12 years across New South Wales Health. For the past 10 years, she's worked within the Illawarra Shoalhaven Local Health District in various roles involving inpatient rehabilitation, outpatient and community rehabilitation. She has undertaken these roles while returning to an acute stroke senior role at the Wollongong Hospital, which is her current role. Amanda's clinical interests include aphasia, rehabilitation, and teaching students further rehabilitation management. So thank you for joining us today, Amanda, and I'll hand over to you.
Wonderful. Thank you so much, Lani, and thank you guys for having me back again to talk. I really appreciate being able to come and talk to you all about communication partner training and communication post-stroke. So I will share my screen now. I'm going to hit this button and see what it does. Share. Okay. And then I'm going to present. Just going to flip my screen a little bit. Can you all see that?
Yep.
Yes.
Beautiful. So I'm going to talk today about post-stroke aphasia and communication partner training, aiming for successful communication exchange. So I'm going to give you a bit of an introduction about me, which we've kind of done already. I was going to do a little bit of an icebreaker, but I do know a little bit more about you guys now, so we can see if that's still applicable. I want to talk about what is aphasia. I want to talk about what communication partner training is. I'm going to give you a bit of a case study of a patient that we had here in our hospital setting, and just the speech pathology input that he had throughout his journey from his acute admission into rehabilitation and then out into the community. And I think that could lead into some really nice discussion about your journeys. And then I just want to I want to play a video for you about some tips for communicating with a person with aphasia. And then I've just found some resources that are available to us that you might be interested in looking at in time that just give a bit more of an overview or some examples of what successful communication exchange can look like. So about me, we just heard I am a senior speech pathologist at Wollongong Hospital. I have been a speech pathologist for 12 years, which feels like a really long time, but I just really love what I do. Working with stroke survivors is really my passion, and I have a particular interest in aphasia. Every person that I meet has a different story. There's always that commonality that it's a stroke that you've had, but there is no single stroke that is the same and no single presentation that is the same. So I really appreciate hearing everybody's journeys. I also enjoy teaching and training, which I get to do quite a bit of through our student unit. And I continue to develop our stroke service here in the Illawarra. We've always got something to learn and something to grow from. I've just put my contact details there for future reference. If anyone would like to reach out, feel free to. So getting to know each other, I just wanted to know a little bit about all of you. So I was wondering if everyone online is, or who online is a stroke survivor, who online might be a family member or a carer, or if there were any health professionals online. So I'll kick it off with the first question. Are you stroke survivors that I've got with me today?
Yes.
Yeah, beautiful. Yeah, nice. And do we have any family members, carers? Yeah.
Yeah.
Beautiful. And then I think you've given me a bit of an idea of where you're joining from when we did our introductions before. So I love that it's a vast range. I think I'm in the southernmost portion of that actually. Now, I was talking to Lani just before about Slido, and we weren't sure whether it would be something that would be applicable, but I think because we have a small group, it will be relatively easy to do just by verbally responding. So in the room with us today, who has aphasia, or does anyone have aphasia? Do we have any? Yep, beautiful, Alan. Hi, Alan. Does anyone else have aphasia? Fatima? Yep, a diagnosis, beautiful.
I sound like it when I haven't had enough sleep.
Absolutely. It can vary depending on fatigue levels. Like you can feel quite okay most of the time, but when you get tired, you just have a little bit more trouble getting out what you want to say. Absolutely. Have you ever received education about aphasia from a speech pathologist? Anyone here?
Yes, Alan
Beattie?
has.
Yeah.
Alan's been under a speech pathology for his aphasia for 20 years and 6 months.
Wow. And are you still under a speech pathologist, Alan? Do you still see a speech pathologist?
Yes, every fortnight.
Very good. And Fatima, how about you? Did you ever get education about aphasia? Sorry, Dallin, you're on mute. Okay. Oh,
Fatima, you're just
sorry.
on mute. So, yeah, we
Sorry,
go.
darling.
I have 8 years speech therapy. I am much better now.
Beautiful.
But
That's good.
Still going.
Still going.
Yeah, I am.
And have you had education about your aphasia? Someone has a speech pathologist?
I know a little about it.
Yeah, beautiful. And how about communication partner training? Have you or Fatima or has Alan, family member, had communication partner training?
Yes.
What's that?
Have you had communication partner training?
No.
Yeah. Yes.
Yeah, you guys have?
I have.
Yeah.
What's that?
We're going to talk about it today.
Okay.
So let's keep going and I'll explain it. And then you might be able to say whether you have or you haven't had it or your family member has.
Okay.
All right. So I just thought I'd come back to basics and talk a little bit today about what is aphasia. So aphasia is an acquired language difficulty that happens when an area of the brain is damaged. There are different reasons for why aphasia can occur, but the one that we're going to focus on today is stroke. And stroke is actually the leading cause of aphasia. It is a common occurrence. It can occur in about 140, or there's actually about 140,000 people in Australia who live with aphasia today.
How many?
140,000.
Stroke.
Yeah, post-stroke aphasia. So what is aphasia, or continuing on with that, what is aphasia? Aphasia can make it hard to understand what people are saying. It can make it hard for you to say what you want to say.
Yes.
It can affect your reading or your writing. It can also affect your use of gesture or your use of numbers. We often talk about expressive aphasia and receptive aphasia, and that breaks it into receptive aphasia is looking at like your understanding, or your expressive aphasia is looking at what you say. Receptive aphasia might be looking at your reading and your understand or comprehension of what you're reading. And expressive aphasia might be more the written output that you put down on the paper. Does that make sense?
No, for me it is, I can write very, very well.
Yeah, good. So that it can impact it affects everyone differently. Yeah, so some people will be okay to write. Some people will use gesture really well. Other people will be able to verbally say what they want to say, but they don't understand what people are saying back to them. It can affect so many things in a person's day-to-day life. It can change how you have a conversation. It can change your relationship. It can change if you can work or how you work. I know that there are people within your community who have returned to work post-stroke with a communication impairment, but they have returned to different roles. There's also impacts to studying and to hobbies. You might not be able to participate in the activity that you did before, or they might have to alter the way the activity is performed in order for you to access that. So this is probably my key message is aphasia affects everyone differently and to varying degrees. As you said, Fatima, you've got really good writing skills. You can write down what you want to say, but
No,
perhaps,
I don't. I write from. I know not that. I have a right to write letter, stories and so. I mean that way.
yeah. But I guess it's every aphasia is the reason why it affects
Yes.
everyone differently is due to the location and the severity of the stroke.
Yes.
Okay, so the stroke guidelines changed in the last couple of years. So the National Stroke Guidelines from the Stroke Foundation were updated to say that communication partner training should be provided for carers and family members of people with aphasia after stroke as an evidence-based intervention that can help promote communication and engagement. It also changed the evidence, or the evidence became stronger around communication partner training for health professionals or volunteers who interact with people with aphasia after stroke as well, which means like your kitchen staff, your nursing staff, your doctors are all now being encouraged to have communication partner training as a basic tool that they can then utilize and engage with patients with aphasia at all stages throughout a hospital admission. This is something that I know across the state of New South Wales, all speech pathology departments are working towards at the moment, and we're all doing it in different ways. We've down here in the Illawarra, we're really targeting our stroke ward and our rehabilitation wards, looking at our nurses first off, and also our kitchen staff. And I'll explain why a little bit later. So what is communication partner training? Communication partner training, or it's often called CPT, is an evidence-based intervention that teaches communication partners how to best support conversations and interactions for a person with aphasia. So the communication partner might be a family member, a friend, a work colleague, or anyone important to the person with aphasia. And the communication partner training has the intention of improving the communication, participation, and or well-being of the person with aphasia in a way that makes them feel appreciated and heard. So the literature came back that for those who have a communication partner who has experienced communication partner training, that their levels of engagement in just daily life and activities was rated much higher than those that did not receive the same. The evidence also stated that people whose family members received communication partner training also felt like they were able to engage with health professionals better. and make decisions regarding their care. It also impacted their mood. So there was a lot of strong evidence about why we wanted communication partner training to be a regular practice. And it's not a new tool. It's just now being highlighted as the stroke guidelines have changed as being a very useful tool in the management of aphasia. So it's been around for a long time, but we're only just really seeing, or just really saying that it's a really beneficial tool to have. And the reason why it can be so beneficial is that it's not limited by severity. So you can have the most severe aphasia and provide communication partner training to those people working around the person with aphasia, and you will enhance their communication experience. You can have a mild aphasia and you can support them with the people around them having communication partner training, and they will equally feel inclusion and a much better engagement with the person that they're communicating with, or have much more successful exchange in communication. So I like to talk about this, what we call skill-based communication partner training. And this is where we actually teach the skills for communication partner training. Because in the past, we've always provided education about aphasia and about ways to help communicate. We'll often say, the person has aphasia, you need to give them time to respond, minimize background noises, offer binary choice or offer yes, no questions where you can, use gesture or write it down. And we'd say those things and we would say that's communication partner training. But in fact, communication partner training isn't achieved until we teach someone, the communication partner, how to interact. So we've identified that the person has aphasia. We've identified what they do well. We've worked out what they're struggling with. It sits as an aside to interventional therapy. It's an additional thing that we would do. And we will teach you all about the best ways to engage. And that might look like writing information down. Oh, sorry, Evangeline. Do you have a question?
Sorry, Amanda. I
Yeah.
need to go.
You're right, darling.
Okay.
Bye.
Okay, bye.
So while we teach the person with aphasia, the communication partner training, communication partner, sorry, how to best engage, we then model that through an actual conversation, and then we ask the person and the person with aphasia and the communication partner to have a communication exchange, which we then provide feedback on. And then we go through it all again. We talk about what the successes were in that communication exchange. We look at things that can be improved upon. It's really helpful to see what successful communication exchange can look like in order to understand that using different strategies like writing information down or drawing, and the benefit of those strategies, how they can actually help somebody. It's really important to see it in action. So let's have a quick look about Joshua, his aphasia journey. So he's a young man that had his stroke in June 2023, and he was admitted to our acute stroke unit. He was seen by speech pathology for a swallowing assessment within 24 hours. That's that's a standard referral that we'll typically get, is for a swallowing assessment or a swallowing screen within the first 24 hours, despite his biggest difficulty being communication we're often asked to come and see for swallowing first. We then completed his communication screener on the second day of his admission, which is quite typical and quite normal. On day 3, though, we came back and we did what we call a formal aphasia assessment. So if we've identified on the screener that there is a presence of aphasia, we then need to delve deeper into the aphasia and work out exactly what difficulty the person we're assessing is having and the things that they can actually do. Because despite having deficits, most people who have aphasia also have strengths or things that they can do. And in any environment, we want to know what someone can do as well as the things that we need to work on. So he was found to have a mixed expressive and receptive aphasia, just meaning that he had difficulty both saying what he wanted to say as well as understanding. And it came through in his reading and his writing. But his strengths were in his automatic speech. So he could count, he could say days of the week. He had just some straight utterances that came out. He was able to answer yes, no questions. He was able to make a choice from 2 options. And so he was able to read. He had difficulty with thinking of the words he wanted to say, and he would often make what we call phonemic or semantic paraphasias. So he would insert words that were not quite the word he was looking for. So our key thing in the acute setting is to provide aphasia education, written education, to all our patients who have aphasia. So that was provided. We talk it through with our patients with aphasia, just in case reading isn't a strength. We want them to also be able to hear it in a different modality. So we read it, we look at the pictures, we discuss the stroke, we discuss the aphasia, and we talk about recovery. And then we made a recommendation for rehab or rehabilitation. He had more during his stay. He had an additional education session, but we also included his family, and we focused on using the word aphasia. I'm not so sure about your experiences, but one of the things that we had found here maybe about 7 years ago was that nobody wanted to use the word aphasia. No speech pathologist in our department would use the word aphasia, which is actually quite interesting given that we were diagnosing communication impairments. And part of the reason was because we were afraid to make the diagnosis in one sense, because were we labeling someone that didn't need to be labeled? But I think in another sense, we felt like we were taking away someone's hope. It was identified by the research that this was actually unkind in a way to our stroke survivors with aphasia, because we weren't actually giving them the information that they needed to understand what was going on. And so the research actually states that we need to use the word aphasia when we're providing education to someone with aphasia, so that they have a way to say, I have a problem with my talking. It's known as aphasia. So this was something that we have really worked on. And so for all our patients, when we provide education, we make a huge concerted effort to say, this is aphasia, while also working on those strengths and those areas to improve. We won't always break it down into, I'm sure you've heard of like Broca's aphasia and Wernicke's aphasia, the different subtypes of nomic aphasia. We don't typically in the acute environment state those in our service. We don't state exactly which one it is unless we're very certain, because we know that things can change in the acute environment quite rapidly. So at the time, we also identified the key communication partners in Joshua's family, but we didn't commence communication partner training at the time. His admission was about 5 days before he was sent off to rehabilitation. And a typical acute admission is anywhere between 3 and 6 days. Some of the issues that he encountered was trouble ordering from the menus. Yeah, I can see the nodding. This is an area that is a particular difficulty for us here. We have kitchen staff who have like an iPad where they have the menu written and they will read what's on it, but the person in the bed, the patient, will not be able to see what's on the menu. They do have paper copies, but they're very rarely handed out unless we really specify we need the paper copy, which is something that we're starting to focus on. But for Joshua, it wasn't an option at the time. So he was having a lot of trouble ordering because the kitchen lady would come past and she would say, you can choose from cereal, a hot breakfast, you can have tea, coffee, milk, sugar. And Joshua would almost stare at as a blank. It was too much information for him to process all at once. Yeah. And that often led for him to not be able to engage. And subsequently, the ordering then happened like automatically. It was locked in as per the last kitchen order, as what the last person had written. And then no one came back to see him during his admission. So he was getting food and drinks that weren't typically his favorite things. And so he wasn't eating, he wasn't drinking. Another issue was that his medical team wouldn't talk to him directly. People often spoke around him. He had enough understanding to understand keywords. So when the doctors were talking about certain aspects of his care, he understood certain parts of that care. And what the doctors didn't realize was that as much as they were saying about him, he was getting information, despite them not talking directly to him. And that's a common occurrence as well, is that people will often talk around someone with aphasia rather than to someone with aphasia. And what we don't appreciate there is that the person with aphasia still can pick up keywords. They can still pick up on body language. They do still see gestures and facial expressions. They're not unable to pick up cues in other ways. Communication happens on so many different levels, and that's something that we don't appreciate, I don't believe. He was not asked at all during his journey about his care, and some days he wondered why he was in hospital because he didn't feel like he was getting enough intervention. Even though it was only 5 days in this acute setting, some days he sat there without any input, and it was hard. He went on to rehab, where he had a period of intensive therapy. So as I said, communication partner training is not a standalone intervention. It's an adjunct or an additional type of intervention that helps the people around Joshua, but also Joshua himself, or the people around the person with aphasia, as well as the person themselves, to engage with the world around them. So he was receiving intensive therapy targeting the word finding difficulties and following multiple stage instructions, as well as reading and writing. Aphasia education was revisited. Now, that puts it at about 3 times so far we've spoken about aphasia education with Joshua and Joshua's family. And the reason for that is in each of those environments that he comes into, it's overwhelming. Like the very first stage of his admission, he's just been told he's had a stroke. in the second part of his admission, he's getting all of this input. He's wondering about his future. And we want to continue to revisit, this is aphasia, this is what we're working on. These are the things that can help you. This is what your journey might look like. So Joshua helped to identify his communication partners again, because he didn't have the communication partner training commenced in the acute setting. So his brother and his mum were his key people. So then, in addition to his intensive therapy, some communication partner training was commenced with his mother and his brother and Joshua together. The good things that came out of this were that Joshua could identify what was helpful and what he didn't like from his communication partner, which he didn't like people talking for him. I think again, with the in aphasia care, we often don't ask the person with aphasia, is it okay if we help here? We don't look to find out what about our interaction is actually helpful. Sometimes it feels like we're helping by talking for them, but in actual fact, we might be increasing frustration, especially if we're not getting the right output for them. So Joshua actually said that it wasn't, he didn't want his communication partner speaking for him. He wanted time to respond. He wanted written prompts because he had found that that was working best, but also some encouragement to use some natural gesture, because it wasn't his natural go-to, but it was something he could also use really well. So once Joshua graduated from rehabilitation and went home, he continued in our outpatient services. He continued for 6 months before taking a break. His mum and his brother regularly attended sessions where they would talk about the communication that they were having at home, the difficulties they might have faced, some of the challenges, some of the barriers, and then they were, the communication partner training was revisited. We spoke about the different ways that could help Joshua to engage best. So was it removing distractions from his environment? Was it about utilizing the writing more in different settings? Was it allowing time? Because often Joshua's brother would be in a rush and he wouldn't be able to stop and have that conversation with him. And so it was about reteaching some of these concepts back to his brother and to his mother. It was modeling what successful communication exchange could look like and providing feedback. And often this is a challenging thing as a speech pathologist, is to provide this direct feedback to people, but also for people to provide this direct feedback to their family members. If it's not going right or if it's not helping, we need to be able to say, actually, what you did there wasn't quite helpful. What we would try to do differently is this. So I just wanted to show you some different resources that I had found along my way, along my journey. So just some different things about aphasia and communication, how to best communicate with people with aphasia. So encouraging that use of paper and pen, saying one thing at a time. I think we're often in a rush, so we're ready to run through our conversation and we have our topics A to Z and we start at A and we speed through to Z. So taking your conversations one point at a time. Not pretending to understand, but being open with the person with aphasia and saying, I'm really sorry, I actually didn't understand that. I know that this is confusing, or I know that this is hard, but can we try again? And having another go if it's appropriate. Writing down keywords. Reducing background noise can have an amazing effect for someone with aphasia. just some simple tips. So then I've just got a little video, and it's about, again, how best to communicate with someone with aphasia. Are you up for watching it?
Please.
Yeah, all right.
Yeah,
Okay.
very good.
Is there supposed to be sound?
Sorry. Apologies. I just really like that video for the way it really acknowledges like that aphasia time and slowing things down.
Is that meant to have sound?
Oh, did you guys not have sound to it?
No, because
No.
Alan couldn't read it, so he doesn't know what it was about.
It does have sound to it. It's a whole story. Oh, that's so, oh, I don't know how to make the sound happen. Lani, do you have any suggestions?
When you share your screen, there's a little check box down the bottom that says share sound that you have to tick.
Oh no, do you guys want to watch it again with sound?
Yes,
do
please,
it.
because I'd like it on
All
the
right.
tape.
All right, give me a moment. All right,
You may have
When-
to unshare and reshare.
unshare, reshare. Okay,
Yeah.
bear with me. Technically challenged over here.
All the last ones to criticise.
Yes,
Had we
true.
ever?
Well, I'm in good company then in that
Yeah.
case. All right, let me see this one. Oh, sorry, still talking to me. No, there we go. All right, so I've just fixed that. I'll undo that. Okay. Can you see my screen again?
Yeah.
Yes.
Beautiful. I'll just put it up into presentation mode, switch these around, and then press play again. Or if I press play, it should come up, shouldn't it?
Mm-hmm.
There's nothing.
No.
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 Being heard.
Do you want to just send the link to me and I'll do it?
I would love that. Let me just, I'm going to stop sharing again, and I'm going to do, I love that I'm not kind of technically challenged.
It means that you're getting on with the real things that need to get done.
It's very true. It's very true. All right, let's see. I have some extra really cool resources as well to share at the end, just as a heads up as well, that has some different things or different examples of communication partner training successful exchanges. So I will highlight those when we get there. Let's have a look. Which one? This one. Okay. All right. I'm just going to copy that, pause that. Yeah. So many steps to do this. I'll send it to Alani. Beautiful. Oh, it just copies it weird. Copy. All right. Send anyway. There we go, Lani. That should be coming to you with no subject. Yay.
At the National Aphasia Association, we often receive emails asking the same question: how can I best communicate with someone who has aphasia? Aphasia-friendly communication is just good communication that benefits everyone. It helps if you use the letters from the word aphasia to remember these 7 simple tips. A stands for ask simple questions. Can you phrase your question as a yes/no question or ask for a thumbs up or thumbs down? P stands for provide choices. Instead of leaving the question open-ended, give a few choices to simplify things. H stands for help communicate if asked. Don't speak for someone with aphasia. Give them time and space to request help filling in a missing word. A stands for acknowledge the frustration. People with aphasia know they have aphasia. It's okay to kindly acknowledge that they're frustrated and should take their time to speak. S stands for speak slowly and clearly. We like to tell people to adjust to aphasia standard time. It's okay to relax and enjoy a slow conversation. People with aphasia have something to say, and so do you. So let's be sure you understand each other. I stands for if you don't understand, say so. It's better to tell someone you don't understand and ask them to say it in another way, use hand gestures, draw, or point, sometimes using 2 forms of communication at once, such as speaking and writing, increases understanding. Finally, A stands for allow extra time. Take the stress out of the conversation by slowing things down, pausing, waiting for the other person to think and speak, and enjoying the act of communication. Rushing someone with aphasia can make it challenging to find the correct words. In this world where we rush, people with aphasia help us slow down and connect. So practice aphasia-friendly communication and pass this video to friends, family, community members, and coworkers so they can do the same. Thank you for being a caring, curious person and helping people with aphasia.
It just makes me smile. The American accent is a bit too much, but the content makes me smile when they're talking about aphasia standard time and let's like slow it down and make sure that we understand each other. Let's use 2 forms of communication rather than just one, because that could help us get the message across better. We often call that multimodal communication in the hospital, where we encourage people to use more than one method to communicate. So I just really liked how that video, one, used the acronym of aphasia to explain different ways, because I think that can stick in our mind a little bit better. We're talking about aphasia. Okay, we've got to remember to slow ourselves down, ask simple questions, help communicate if you are asked, and allow extra time. All of those things. How's Alan going there? Did you get it the second time with the video?
Yes.
Yeah,
Yeah.
a bit better. Nice. I'm glad. I'm so sorry that it didn't run through with the sound the first time. I was too busy sitting here enjoying it by myself. All right. I'll share the last slide because it's just got some nice little resources that might be of benefit. All right. So some helpful resources. The first resource that I've got, the first resource that I've got is a video, and it's a short, like 10-minute video, which is called "What a Difference Some Help Can Make," and it demonstrates the benefits of it. Well, it looks at communication partner exchange without any communication strategies put into place for the first part of the video, and it's really hard to sit through. And the second part of the video is actually where they start utilizing some of the tools. So writing information down, using a map or a picture to try and help orient the person to where they live and things like that, which I think is just a fabulous way to demonstrate how communication partner training can make a difference, or having a communication partner that can utilize different resources can make a huge difference to the person with aphasia. The stroke guideline has different ways to manage communication. It's probably not the most helpful resource there. But this communication training aphasia pathway has different resources that I found quite interesting to look at. This is an example video, pre and post communication partner training for a gentleman named Gary. It's another example where in the first video, it's quite a quiet exchange. It's only the person without aphasia who can communicate, and the person with aphasia can't engage. But then subsequently in the follow-up video, you see how when some communication strategies are brought into place, it's a much more equal conversation that's had between the person with aphasia and their communication partner. And these are also the Aphasia Institute just has a wealth of information for family members and friends of people with aphasia, and tools around supported communication that I think are excellent. Like, they're free resources that can help support us to better communicate with our friends and our family who have aphasia. If in the instance that you're unsure, these things are things that you can do without too much time or energy, and they're not specific to one type of aphasia or one type of presentational person. So I think that that's what I really like about them. They can be used with anyone. Okay, and that's my presentation. So I will stop sharing my non-screen with you and come back. So that's my presentation for you guys today. Is there?
Last thing, you like those, but then there were so many given if we could have them?
Yeah, I'll send my slides and everything straight through to Lani so she has the resources and things that she can share with you guys. You might be able to attach it in some way to the presentation, Lani, or to the YouTube. You're on mute, sweetie.
Slide should the slides will come up automatically, but we can add a list to the resources in the information section.
Perfect. I'll just send you through my slides and you can do your thing. Awesome.
Nice.
What do you guys find most helpful? What helps with Alan with his communication when he's talking to you or to family?
Try other words.
Yep. Do you just prompt him to try a different word?
Yes.
Yep.
Oh, and the hard thing is trying not to say what it is when I know what it is.
Yep. Does that, like, Alan's not a fan of people talking for him?
No.
Good.
No.
Yep.
He hates the hospital because with the ordering the food, the girl with the iPad, all he hears is blah, 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 blah. And he'll say, I don't understand. And I'll say, I can tell you what he wants. No, you can't order for him. So then I found out if you go to the manager of the rehab, she will give you paper ones to fill out for a week. So I know that now.
Yeah, this is something that I'm working on in our hospital at the moment, particularly because the paper ones are actually available to every ward and to every patient every day.
Yes.
So yeah, I'm glad that you've actually been able to work out how to get that in your area and in your hospital. But definitely something for everyone to keep in mind, that you can ask for a different format if it's not working for you. There is other formats that the hospital can provide. It's just knowing that you can ask.
Yeah, because they don't tell you.
They don't tell you.
No, and I think it's
Not in
wrong.
their
When they can
interest.
tell they've got aphasia.
Yep.
They need help. They've got a
Yep.
carer.
Yep.
I just think it's wrong that they don't tell you that.
And unfortunately here, like, I'm not, we actually find that even on our wards with people who can communicate, similar things occur. So it's a very ingrained, I've got to get to the bottom of it, but I suspect that there is some time management issues with it. I think our food services are given a certain amount of time that they're allowed to actually come onto our wards for. So maybe like a 15-minute period of time, and to stand with someone for 10 minutes for them is obviously raises high stress, because that's one person and they're not going to get back to the kitchen. So I've definitely got a lot of work here with that. But if I get any other pearls and nuggets, I'll be sure to pass them along.
But you think they'd realise if they had the paper copy to leave there with the person?
Absolutely.
And if a family
No,
member
it's about being everything digital, so that then
Yes.
guess what? It's one wipe, it's done. Everyone tick boxed, everyone got fed, whatever. No one got fed because no one actually ordered anything.
No. And often they don't order what they like. Someone doesn't get the option to, and
There's no opportunity for that patient expression.
And if you think back to Joshua's story, like, often he was wondering why he was still in hospital. That one experience with the KitchenAid in the morning or at midday might have actually been a communication exchange that helped his communication develop and expand in an environment where, like, he can't always be in speech therapy, physiotherapy, or occupational therapy. We can only do so much there. But unless his family is sitting beside him, that would have been his only other chance for communication exchange, and that was taken away from him. So
yeah, it's too fast. They come in, blah, 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 and out they go.
And that's when you can actually understand them.
Yes.
And I'm not being, I'm just a good observer. I was a nurse for many years.
Yep.
And, they don't care because they're not made to care. It's
No.
not in their repertoire for
Repertoire.
their normal things. So you can see why it happens. Why people fall through and wonder why they're getting dehydrated because they're not eating or not drinking.
Yeah.
Exactly.
And, from a nursing point of view, because they're looking at like, oh, the constipated oil hill because they're eating all the rubbish stuff, you know,
Yeah.
Yeah.
normal food.
It's also that I think the idea that our world and our society is a lot more rush, rush, rush these days. It's not just our kitchen staff that feel that kind of
Yes.
pressure and demonstrate that. You probably experience that in your everyday, like when you go to doctors' offices or when you go even to have a cup of coffee. I feel people don't have the time to have that exchange with you.
Yeah.
I think,
I won't even let you put your money away in your purse and they're shoving along in the meantime.
yes,
And I
Yeah.
just look at them and I get grumpier and grumpier. And I go, excuse me, move back, I pretend to cough.
Where our children go now to have meals, where the grandchildren like to eat, you've got to order on the screen thing.
Oh, I hate that. I hate those things.
How does Alan go with that?
Well, he can't do it.
How
So,
do you help him with that?
well, we sit back and we watch the screen that they have up the top, but there's not a lot that Alan can choose from anyway. I actually got enduring guardianship, so I could say what he could eat, but since COVID, they've told me it does not. You don't. It's nothing that it doesn't come into play now. So I don't know why, but they said COVID stopped all that.
Oh, I'm not sure about that bit, but yeah, wow. It's challenging. It's challenging as his carer.
It is, because even if he has day surgery, he can't tell him his date of birth. So I had to have that so he could actually go and have the surgery, because I had to have to answer his date of birth. And if I didn't have the enduring guardianship, which the first time, because he couldn't tell him his date of birth, well, they said, well, we can't do this operation.
Wow. So that there's challenges like that that you face. And you were saying he's still 20 years post and still has speech therapy every 2 weeks.
Yes.
Has he ever taken a break?
He has had a break a couple of times. But I really think if he has it ongoing, he does a lot better.
Yeah. And
If
he
he has
continues to improve?
Yes.
Yeah.
If he has a break, he goes right back.
Okay.
Whereas if it's ongoing, it
Interesting.
improves. But he's got a pen now that reads for him.
Nice.
And that's a big help, because I don't have to read him the speech questions that he's got for homework.
Nice.
He can read them.
Yeah.
So
that's really cool. What a useful tool. Yeah.
And he can read the menus if we go out.
Oh, that's actually really helpful too. And then he could probably read the menus in hospital if he was in hospital.
Yeah, but
if they were paper.
Yes.
How about you, Andrew? Do you have anyone in your group that has aphasia?
I actually went online with the Maitland group.
Yep.
And I found it immensely improving me as a person just to sit back, because I've now got 3. I had one at the time. I was trying to help him, and he's brought 2 friends along, and we're doing a lot of work with them. I make them talk every meeting. They've got to stand up and tell me what they're doing. And luckily, it's the day before they've had their aphasia meeting, so they actually come and talk to me about that, which is really, really good. I think I'm a better human being because of the aphasia that these people have got. I learned to understand what they're doing and what I should be doing to be a better person.
It's an amazing group.
Yeah.
It just works so well. If we could run our groups like they run their groups, it's just amazing to be part of it.
The girl said to me, "You don't get an easy ride here today. You've got to get up and talk as well," which was really, really good.
Yeah. So was that their aphasia group, the Maitland aphasia group?
Yes.
Nice.
That
So
So
they
it was
meet,
Emma.
Yes.
Maitland meet in person every week on a Friday, but they also have a Zoom component so that people can join from anywhere and participate through Zoom.
Wow.
Yeah.
That's so good. And I love that you said, Andrew, that like it helped you to like it's helped you to become a better person in a way. And I think that sentiment was almost said at the end of that video that I showed, that we can actually benefit from like people with aphasia have something to say, something meaningful to tell us, and we should be able to have that conversation with them and not shut them down because they've got a communication impairment, but if anything, embrace it and bring them into the fold with us.
My group, we have a meeting that lasts about 40 minutes, and then I say, right, cup of tea time, and we go out into the club and just sit around and chew the fat. And I think our group get as much out of that as they do listening to me waffle on about something that I've learnt online.
Yeah, absolutely. Because we're social people, we're born and designed to have conversations and interact with each other. And having the ability to have people around you that support you and encourage you, such as what you've done, it makes the world of difference. It can be so isolating, and the data doesn't lie when it comes to people with aphasia and mood. Mood is often a big component that we see is impacted by aphasia, and social isolation is a factor or is something that occurs quite frequently. So it's actually really nice to hear that, like, you had one person with aphasia come into your group and they realized or they saw the benefit and your willingness to want to change and improve, and now they've brought along 2 more people. Like, that's wonderful.
So what we should be about is looking
Yeah.
after one another.
Yeah, exactly. Absolutely. I love that. And how about you, Fatima? How do you find communicating in your community when you go out and about?
No, not in the community. Not in the community.
Yeah.
No, don't have
No.
one.
No. Do you go out? Do you go out for coffee, or do you
I
go to the
to a
shops?
church, every church, go every Sunday.
Yeah.
And there I meet some of my friends. That's all.
Yeah. How do you go communicating with your friends?
I can talk I hope I talk very well most of the time.
Yeah. That's good. So
yes,
most of the time you talk quite well.
Because my speech is to talk very slowly and very slowly to talk. I talk fast and I forget. I don't remember.
It gets away from you a little bit if you talk fast. Yeah, so your strategy is to slow it down.
Yes.
And to get the words to come out.
And I get wrong word and something. But now to see me lists of sentences where I've stopped every like stop and put a long line.
Yeah.
Stop then stop then.
Yeah. Just take a bit more time.
Yeah.
Do your friends understand?
Yes.
Yeah.
I am. They understand.
Yeah. And are they really supportive?
Yes. Speak well and they. Yes, very good. Very well. They don't know that It irritated me.
It doesn't, what was that? No.
But this, but I can better in writing. I write stories and things.
Could you always write post your stroke?
I was teacher.
You're a teacher?
Teacher,
Wow.
yeah. So from then, from 8 years ago, I got a stroke. Then I don't teach.
So you were still a teacher when you had your
Yes,
stroke? Wow.
64. I stroke.
Okay. Yeah. And you never
Mm.
went back to teaching?
No. Nobody take me.
No. Oh, I don't believe that. I reckon there's a whole community of people that would probably take you.
But
Oh,
I'm trying to go to schools in the afternoon.
yeah.
I'm going to ask.
Thank you.
Was not for money, not payment, but volunteer.
Yeah. Nice.
Mm.
Oh, so you're going to volunteer. What grade do
Yes.
you like to, what grade do you teach?
Anyway, I taught in 20 years in primary
Nice.
and 10 years in secondary. Now I want to primary itself.
So good.
I want to go and ask that near my house, the many houses, many schools.
Yeah. Many schools.
Yeah, not
Yeah.
very near. In Parramatta, so
Yeah.
many schools.
Nice.
I want to, if they'll take me for the afternoon.
Oh, I reckon you should ask. They've got the volunteer reading programs with the
Yes.
kids and stuff, especially the primary school kids. It's called voluntary
Yes.
reading program. And
Yeah,
they can,
something like that.
yeah, and they're always looking for people for that.
Mm.
You can
like
always
to-
go and ask.
I like to make different things,
Like
singing
craft.
and all.
Oh,
And singing, I'm not very good at singing, but just
But
pronunciation.
kids don't judge.
Yes.
That's the beautiful thing about kids. They don't judge.
Right.
They'd just be happy that you'd be spending time with them.
Yeah. I like
Oh.
that. I like that.
Yeah.
Now it's been 8 years. On October 2nd, 4th, it will be 8 years. I got stroke.
Yeah.
Mm.
And you've still got goals and you've still got
Yes,
things that you want to continue to do.
I do. I'll be 72 in September.
Nice.
So I want to 8 years. I have no work and not do anything. I want to go back.
Yeah.
I
That
don't
can
want
be-
payment. I don't want any payment.
Yeah.
I get pension enough.
You just want to be
Yes,
back with what you love doing.
right. I
Yeah.
like, and I write stories. Yeah,
Yep.
but not publish in it.
Okay.
Uh,
Oh,
uh,
so good.
Publish means out. I write short stories about my husband, all his children. I write about them.
Okay.
Mm.
So like your family.
Yes.
Yeah. Beautiful.
Now I'm not done. I have not written for a long time.
You haven't?
I am making the something like what I the what's it, birds and Dixel in for crossword stuff.
Oh,
I try to do that every day. Do two.
you do 2 crosswords a day.
Two, not something little different from it, easier, but I do 2 a day.
2 a day. Beautiful.
Mm.
And is that a communication partner you have next to you?
Yes, and my husband here.
Yeah.
Here is.
Beautiful.
Mm.
Hello.
Hello, hi. Hi.
Hello.
Hi.
Hello.
Mm.
So good.
Uh,
Nice to see you.
yeah.
Very good.
Does anyone have any other questions for Amanda?
We will go. No. You know on those list of units, list of the what you have given will give it on the computer.
The resources.
Oh yeah.
Yeah, I'll send them through to Lani and she'll be
Okay.
able to link it in.
Mm.
So you'll be able to access those.
Yes.
They were just some resources that I found that I was actually quite chuffed that I found along the way. They were amazing. There's
Oh.
so much coming out at the moment because it is such a focus.
But nobody gives me.
What's that?
Nobody gives them to me.
Oh, so these are ones that I just found online as I was researching, and I'll pass them along to Lani. So then you'll be able to access them through the
Yes.
Stroke Recovery's internal.
I'll put them on the Facebook group and link
Yeah.
them into the YouTube channel. Yeah.
So they'll be there for you, Fatima.
Oh yeah, thank you.
That's okay. And
It-
like I
it-
said, they're just different things that I saw when I was Googling communication partner training. Because every time I come about it's changing. Like it's actually a very it's a changing area, and I think it's going to continue to grow and expand because it's not been fully it's not been fully utilized to its capacity. And I would say sorry, Alan's wife, I'm not sure of your name. Judy, I would say that things have changed quite significantly from when Alan first had his stroke to now. And you've probably learnt a lot of the communication stuff along the way.
Yeah.
But now we're coming back to it's back to basics in a way, what we're explaining and what we're talking about when it comes to communication partner training. But it's not what we have traditionally done. Yeah.
It's good that it's coming up and getting talked about again.
Yeah, I think it's a growing space, and I think it's going to be something that in the next 12 months or so becomes just part of everybody's practice, and it's going to become a part of the hospital care particularly. So for me and my team, the big thing is that we're going to make sure that our doctors and our nurses have training about how to best communicate with their patients who have aphasia. We're going to get our kitchen staff trained up to be able to make sure those ordering debacles aren't happening like they happen at the moment. So yeah, I think it's an up and coming space, and hopefully as people with aphasia or family members of people with aphasia or friends of people with aphasia, you see the change that's coming through now.
Oh, yes.
Awesome.
Nice of you to come today to tell all these things.
Oh, thank you for having me.
Yeah.
It's always
Thank you.
a pleasure to come and have a chat.
Yes.
Yeah, thank you so much for coming, Amanda.
No worries at all.
It's been a wonderful presentation, and it was wonderful at the conference. I'm so glad we've got it recorded now.
Yay.
And thank you. So thank you to everyone for joining us online as well. I know obviously a few people had to leave early, but thank you for those of you who did come. And yeah, we'll get the resources onto the Facebook and onto the YouTube group, onto the YouTube page as well, when we get the video up. So just a quick reminder, the next group, next Tuesday is Stroke Chat. So if you're not already registered for that and you want to be, please do so. And then our Topical Tuesday now will be, next month will be about physio and fall prevention and home modification. So that will be great as well. Hopefully you'll be able to join us then.
Thank you.
All right,
Thank
thanks
you.
everyone.
Yeah. Bye. Thank you.
Bye.
Bye.